Thank you so much, Emma. So it's the three of us. My name is Ori McDermott, Adele, Claire, and myself. We are from University of Nottingham, and we are involved in different levels of PPI. So we just wanted to share our experiences and the insights we learned. And all of us teach medical students. So it's just really about sharing our experience. Adele, if you could go to the slide.
Can you see the opening slide now?
Yep.
You can. Okay, great.
Yep.
Yeah.
So if you could go to next one.
Okay.
Yep, great, perfect. So Adele's in charge of slides today. So after introduction, what we want to do is Adele's going to provide a really comprehensive summary of what's PPI. And then I'm going to do a little bit of like sharing perspectives of like what's the point of PPI anyway. And then Claire and Adele's going to kindly share what's like actually doing the PPI, and they're going to share worked examples and maybe not so worked examples. And hopefully we will have some Q&A time if I time it properly. So please do put your questions in the chat, or you can email us later. So maybe Adele, if you can introduce yourself.
Yeah, sure. Before we carry on though, we haven't got any subtitles on the slides, obviously, because there's the three of us on different computers talking. So if you do need subtitles, just a reminder that it's on the three dots more at the top, and you can be able to get subtitles there. So yeah. Okay. Yes, my name is Adele Horobin. Thank you very much, Ori. So I am Senior Patient and Public Involvement and Engagement Manager for the School of Medicine at the University of Nottingham. I've been in post about 18 months now. It's a brand new post, so it just shows that the university is really investing in this. And previously, I was patient and public involvement manager for the hearing theme of the Nottingham Biomedical Research Centre for about since 2013. So yeah, thank you.
Thank you, Adele. And Claire, could you introduce yourself?
Hello, my name's Claire Clouser. I've been involved in PPI now for nearly 20 years. I'll tell you some of my background a little bit later when I'm chatting with Adele, so I don't want to spoil any of that. I would describe myself as being an expert partner in patient and public involvement, particularly in health, but also in social care to some degree. And Adele is my preferred partner, as is the phrase these days.
Brilliant. Thank you, Claire. And I'm Ori McDermott. I'm a senior research fellow in the School of Medicine, and I specialize in dementia care. So I'm going to share about my work a little bit later. But first, Adele, if you could lead us through what is PPI presentation, please.
Yeah. Okay. Great. So I'll give a brief introduction to patient and public involvement, maybe particularly helpful for those where this is quite new to you. And for others who are more familiarity with it, it's a good reminder and refresher on it as well. So what is patient and public involvement? If I just find the right slide. Bear with, it jumped. Okay, there we go. So really, I guess this is showing how research used to be seen as very much the free play of free intellects, as was quoted by Dr. Vannevar Bush. Way back in 1945, he was heavily involved in the developing and supporting the Manhattan Project. And that really, I guess, that sort of epitomizes the ivory tower approach to research, which we have definitely far moved away from now. And it really, there's a recognition that medical research is ultimately a public service. So it must address patient needs and public interests. And to be able to do that, we need to know what patient needs and public interests are. And the best way to do that is actually to ask people. They're experts on living with their conditions. And as I say, that is the essence of what patient and public involvement is, moving away from the ivory tower much more to a more collaborative approach to research. And really just to emphasize how healthcare is much more than that pile of books, as you saw in the previous slide, the documented evidence. While that is an absolutely crucial part of it, of course, it is only one part of the puzzle in terms of what makes up healthcare in practice. In reality, it very much involves patients and carers' choices on the treatment that they receive, or their ideas about risks and benefits of particular treatments, their values that they have as well, what's important to them in terms of their quality of life, and also their experiences of experience in healthcare. You know, for instance, how can we access a GP is one big question that we're all dealing with at the moment. So, as I say, patients' experiences, their own personal values, what's important to them, and the choices that they have to make, they all feed into the whole reality of what healthcare is like in practice. And so that's why it's really important that we understand patients, carers, members of the public's aspects about health conditions and their care, to make sure that the research is fully informed. And this is a nice quote by Professor Dame Sally Davis, who was Chief Medical Officer up until 2019. She was really very much pro patient and public involvement. She did a lot to promote that. And this is a nice quote in terms of, no matter how complicated the research or how brilliant the researcher, patients and the public always offer unique and invaluable insights. So I think that's good to take on board, that quote. So we talked a little bit about how important the patient's viewpoint is, how integral it is to healthcare and subsequently to the research. We've now got some definitions. So like all aspects of research, there is some jargon. We do have some jargon in patient and public involvement as well. So just be clear about what involvement is. That's about patients, members of the public, actively contributing to research design in some way, or its execution and or disseminating, getting the word out there as well. And it's about researchers welcoming patients and public to join them in producing the study together. And this is doing research with or by people who use services, not to, about, or for them. And you may see this definition quoted by the National Institute for Health Research as well. You may see various terminology used, so PPI. Increasingly, I'm seeing patient PPIE, meaning patient and public involvement and engagement, but they are two slightly different things. Patient research partners, user involvement, etc. There's many different terms, basically to mean people being involved in the study. And then we've got public engagement. This is about keeping people informed about the research. It's engaging with the public to help raise awareness more generally about research and the role that it plays in healthcare. Also sharing the knowledge, sharing the outcomes of research, for instance, and creating a bit of a dialogue with the public about your research in general as well. It could be a community open day, for instance, or visiting a local school. Getting interviewed on the radio as well. We've done quite a lot of that when I was in the Nottingham Biomedical Research Centre. So that's public engagement. And then we have participation, and this is where people are actually taking part in the study. Used to be referred to as subjects, but we now use the word participants. So we're taking measures from them in some way to inform the results. But they all have a nice interplay with each other. So people who've taken part in research may be well placed to then subsequently get involved in future research because they've had experience of what it's like to be a participant. Likewise, doing public engagement out in the community is a really good way of recruiting people to get involved in research as well. So there's a nice interplay between all those three aspects. So why is patient and public involvement important? Well, first of all, there's a moral viewpoint in terms of no research about me without me, as the saying goes. And people affected by the research have a right to have a say in it. And also, much research is actually publicly funded as well. So it's the taxpayer that funds our research. So again, it means that they have every right to have a say and oversight of it as well. More pragmatic reasons in terms of many research funders will only fund the research if there's evidence of patient and public involvement within the funding application as well. Also, funding panels often have lay representatives now who are involved, and they will particularly look at aspects such as the patient and public involvement and how well written the lay summary is as well. But it's also about improving the quality of the research that's done. Making sure that you're addressing, first of all, you're addressing the right questions that are of most importance to patients, and also you're addressing them in the right way. For instance, measuring the right outcomes, doing the most appropriate measures, making sure it's as easy as possible for people to take part in the research. So just to sort of illustrate that, so in terms of patient and public involvement can really help you define the question that you're going to answer. So identifying what is most relevant to patients, what is most important to them as well. And we do have something called the James Lind Alliance Priority Centered Partnerships, which is a very specific methodology for making sure that we're gathering many unanswered research questions from many members of the public and then prioritizing those research questions with them as well. So do have a look at that. They've done I think over 100 priority setting partnerships now for different health conditions. And there are actually particular funding schemes for funding research looking to answer those questions that have been prioritized as well. Also, in terms of basic sciences, helping you foresee the development path right from the lab bench to the bedside. It can be really important to help you see where this is going and what the endpoint should be. Shaping the research design, so agreeing the most important outcomes, for instance, and how to measure those outcomes in the most appropriate way as well. And designing the study around a participant's needs for those who are taking part in the research. It's also about staying focused on the patients, on the public throughout. So understanding the acceptability of a treatment, either a treatment that you're going to be testing in research or maybe a treatment you're hoping to develop from the lab as well. So understanding that what you want to achieve in the laboratory will actually be ultimately acceptable to patients as well. Prioritizing the participant experience as well, understand what it's like to take part, what will be the burden of taking part in the research. And also keeping motivated as well. It can be quite lonely to work in the lab in terms of, trying to get good results, sort of starting to lose sight of why you're there. It can really be motivating to actually speak to members of the public about your research and really gain their insights in terms of where to go next and what would the ultimate end goal be for you as well in terms of the research. Examples of practical things. So again, sort of grounding it in your research in terms of sense checking your early research ideas. In fact, the earlier that patients and public can get involved in your research, right from the earliest ideas, the better really. Identifying the most important outcomes and of course ways to measure them, as I've mentioned. Helping you explain the research non-specialist. This can be really invaluable, particularly for lab-based research where it can be really quite technical. So how do you get the message across in terms of what it is you're doing? And that's really important for your lay summary, which you'll often be asked for in your grant applications. Also, patient-facing material like patient information sheets, really important in terms of ensuring genuine informed consent as well. And helping with disseminating, getting the message out there as well to different audiences. They can really help you judge how likely people will be to take part in the research that you're designing, and that feeds into guiding your recruitment strategy as well, and getting unique insights on the data that you've collected. Really sort of sense checking your interpretations of particularly like your qualitative interviews you may have carried out, for instance. Right. So just as a bit of summary, really, this is a lot to take in on one slide, but if you're going to have copies of the slides after, so please do have a look at this. This really gives an idea of how PPI can benefit throughout the whole of the research cycle, right from prioritizing your questions right through to engaging the public and hopefully initiating change. Patient stories can be incredibly powerful for influencing the clinical practice, getting the policymakers on side. So really do have a look at that to give it a bit of an oversight of how PPI contributes to the whole of the research cycle. So how can you do it? I think first and foremost, avoid tokenism wherever you can. And what I mean by that is where you're doing PPI, but actually you've got no real intention or vision as to how the PPI is going to contribute or make a difference. So be prepared to make changes when you're actually speaking to the public. So first of all, be clear on what your purpose is for involving them. So understand why you're involving them, what you're hoping to get out of it. Do your PPI early as possible in your planning before things are fixed in place, making sure that they have adequate opportunity to have a genuine input. So making sure you're being accessible. And also, as I say, taking on board points raised, listening to people, and actually being prepared to make changes as well. If you cannot make changes, then that's when it becomes tokenistic in effect. So going through to who are your public and patients, who are they? Well, it's anyone who's affected by your research. It could be patients, it could be carers as well, family members, people maybe known as service users as opposed to patients, particularly in mental health services, but maybe other stakeholders as well. For instance, care workers who are looking after people with dementia in care homes. So really just have a think about who will be affected by research, who will be there implementing your research at the endpoint as well. There may be also wider ethical issues at stake as well, in which case you may want to have a more general consultation with members of the public. These may be, for example, using embryonic stem cells, the use of animal models as well, how people would feel about their data being accessed through the NHS as well, and any future impacts on public funding as well that your research may have. So when you've got those wider ethical issues, you may want to include much more a broader public perspective on your research as well. So how can you reach patients and public? This is a bit of a whistle-stop tour, but I hope this gives you some pointers as to where to start. So you can start with local radio. For instance, we do have local community radio stations. So example in Nottingham is Kemet FM, which particularly serves people from African Caribbean communities. So local radio can be a really good way of reaching out to different community groups. Online media, of course, as well, the usual social media channels. Contacting relevant charities, relevant community groups which share your research interests. So, for example, there's many research active charities, some of whom are very happy to support your patient and public involvement, whether or not they're actually funding the research. Using online directories of support. There's some useful directories here. Ask Lion and Self Help UK are both local directories, although Self Help UK does cover nationally, but they are based in Nottingham. And National Voices is worth having a look as well. And they can be really good for finding those groups to talk about your research, and they're very approachable. There are channels set up particularly to find PPI members. So we have the Public Face Bulletin, which is based in the East Midlands. That is the Health Innovation East Midlands is running that, previously called the Academic Health Science Network. So do get in touch with them for advertising. I think they have 1,500 people or so on their list, or for looking at PPI opportunities. You have the National People and Research website, which is run by the National Institute for Health Research. They're a very good way of finding people to get involved in research. It's like a matchmaking service between people wanting to do PPI and people needing PPI members. The Centre for Ethnic Health Research, based in Leicester, again, they're available to help in terms of linking up with particular community groups as well. So this is a good place to start, I think. Local public engagement events. Are there any events you can piggyback onto to gather interest? Maybe have a stall. So, for instance, we're having some success with local primary care networks in Nottingham. They have regular health and wellbeing events, and we're joining in with those as well. So that's a good place to start. And use your own network of contacts. Start wherever you can. It's better to start small and then build yourself up. So that's another avenue as well. Also be mindful that you're also being inclusive. So for instance, digital, we're all very familiar with digital meetings now since the pandemic, but it's still not suitable for absolutely everybody. It can be amazingly accessible for people who can't get out of the house. So it does have its upsides, but also not everybody has access to the internet, so just bear that in mind. And some people may just not get on with online meetings as well, so it's a bit of a double-edged sword, the digital side of things. So always consider alternatives as well if possible. When you're at meetings, consider how everybody's conducting themselves. So a code of conduct may be useful to have to make sure, for example, people are avoiding jargon and that everybody knows the reasons why everybody's at the table. Offering payment expenses at the very minimum, but also additional payments if possible. It really shows that you're thanking them, and it gives a parity of esteem in terms of them being at the table. Minimize any upfront costs as much as you can, of course, for PPI members. Consider, as well as general advertising, consider the more targeted approach to finding particular communities to talk with as well. And that links back to some of the advertising avenues that I showed in the previous slide. And also increasingly really be mindful of the power imbalance. So, you know, you are there, you have the sort of final say, if you like. You're part of the system. People are looking in from the outside. So just bear in mind that the power is with you, and you need to make sure that you're sharing that power. Work on building relationships, good relationships with people, rather than something that's merely transactional, and be prepared to share decision making and be very conscious about doing that as well. So be mindful of the power imbalance. And consider a link to that is considering maybe community venues, as opposed to, not everybody wants to visit a hospital, for instance. So consider the venue, the location where you may be having in-person meetings as well. So those are some pointers. So yeah, so I hope that gives you a bit of an overview, and I'll hand over to Ori.
Thank you, Adele. If you could go to the next slide for me, please. So what I would like to do is share a bit of perspectives of like what's like being involved in PPI, and I'm going to share a few stories from the people I worked with closely. And I'm going to introduce you to Carol. She was our long-term PPI member for Center for Dementia. And if you could click again, Adele, I'm going to read what she's published in our IMH newsletter. So the first visit to PPI after diagnosis of frontotemporal dementia and possibly Alzheimer's and Parkinson's tremors. I was not looking forward to attending, but thought I would give it a go. I expected I would very quickly begin to lose my faculties. This has been far from the truth. Through PPI, I have met some knowledgeable and assertive people who have already some degrees of dementia. I was very impressed with the students who were asking for help with their PhD projects connected to some elements of dementia. And she felt privileged to be in the two research projects with myself and Alessandro. And she soon realized that I wouldn't be losing my faculties anytime soon, because being able to work with people from university and PPI members living with dementia enabled me to regain confidence about the future. So if Ori or Alessandro had not had someone to talk to that is living with dementia, they would not have been able to fully understand what the concerns of the person themselves or their carers or families endured. Therefore, the outcome of the research would have been compromised. As a result, the opportunity for insight into reality of people living with dementia can never be realized. I really think that having empathy with that reality is of prime importance. Yeah, and I just wanted to say that, so Carol got involved in the Center for Dementia Research, but what was really striking was she had lost so much confidence when she received the dementia diagnosis, but partially a lot around kind of unsureness about decision making. So the PPI, and she's okay for me to share this, as she used to be a primary school head teacher, so she really loves teaching. So I got her involved in the BMedSci PPI module teaching, which Claire and Adele are also involved. So we're teaching medical students about PPI. And yeah, so that Carol became part of the original team, and it was really important she was involved because she was experiencing that kind of teaching role again as a PPI member. So that's one example. And Adele, if you could go to next one. And yes, and what did I learn? What did I learn as a researcher working with Carol and her colleagues, other people living with dementia? And you know, this may sound so basic, but as a researcher, as a university academic, we just get so busy, but frequent communication with your PPI members is really crucial. So for example, depends on the condition of your members, but sometimes memory issues is a tricky area to navigate working with dementia care researchers. So, just including reminder phone call, quick phone call to say, hey, how are you doing? Are you okay? Checking in sessions really relevant, and just taking a little bit time longer to build your initial relationship is really important. And so we constantly get feedback from public members, not even PPI members, but wide range of public members. They say, well, university researchers often do not provide regular study updates. So it doesn't have to be something massive, but just a few lines about where your studies are. Once you start involving public members, they really appreciate that. It doesn't have to be like a huge conference presentation, anything, but it's just like how you're getting on, and just thanking them for being involved in the study. That's really important. And yes, PPI takes time, but it saves time in the long run, because really kind of PPI ensures your project's actually useful and meaningful. So Adele has shown you the PPI throughout the research cycle. So if you can really bear that in mind, that would be really kind of useful, just to make sure your projects are actually meaningful. And on the personal level, actually working closely with PPI members personally gives me actually reasons to get up in the morning and carry on with my projects, even when things are a little bit tricky, because you get feedback. And yeah, it's a reminder actually why you're doing your research in the first place, I guess. Adele, if you could go to the next slide. And again, please. And yeah, so before I finish, I'm gonna just share somebody else's perspectives. Chris Roberts, he is currently a chairperson of a European Working Group of People with Dementia, and I've got his permission to share this. He comes to Nottingham to teach our dementia module students. So this is actually the direct course he did a teaching session this year. So Chris and his wife Jane were sharing that after receiving dementia diagnosis, they were left without hope. We had to overcome their own stigma, shame, fears about the future. Then they had to adjust and adopt. Adele, thank you. Next, yep. And getting involved in psychosocial research gave me much confidence back. So I was given the focus and purpose again. Through social media, started getting in touch with loads of people and felt part of my community again, because it's so easy to isolate oneself after diagnosis. And research involvement gives me a sense of value, sense of worth, sense of purpose. Adele? And what he was saying was like PPI, yes, the researchers really benefit from PPI, but for the people with lived experience themselves, that's kind of the hope they need, because it's kind of, it makes you get you out and about, but also meeting the people, building a network of real people again. So experts by lived experience involvement means that we have a new life, and even like diagnosis is a life-changing experience. Okay, so now I am going to ask Claire and Adele about actually doing a PPI, what it is like actually being in research. And so I'm just going to start off, but because Claire and Adele have got a long-term working relationships, I think it's going to give us really good insights if we just kind of have a conversation. So I think that's my plan. So, Claire, if it's okay, I'm just gonna, maybe you can just tell us a little bit about why you got involved in the research and how it started.
Yeah, so basically, I'll just say a little bit about myself and my background so you can understand how this all came into being. So I've just celebrated my 50th birthday this year. But when I was 19, so 31 years ago, I broke my neck in a car accident, which left me tetraplegic, which means I'm wheelchair dependent. I have severe chronic pain. I've got limited use of my arms, and I've got very high health needs. And when you think back, any of you that were around to, 1993 and what we had then, we had nothing compared to what we had now in terms of, all the, district nurses that are available and carers and the whole infrastructure that we've got these days. We had nothing. So I basically was taught by the spinal unit at that time, right, you have got to teach everybody in the community how they can help you. So my doctor's surgery, they were a city centre one. They weren't great, but they weren't bad. And I became their unofficial PAG, their Patients Advisory Group. And that was before any of us had even heard of one. But that's kind of what I became. And I got the disabled parking bay put in, and I worked with the manager really closely. And then in 2005, what happened was the original primary care trust, not the ones we've got now, the original ones, the research and development unit under that primary care trust, they wrote to all the doctors' surgeries in the city centre and in Nottinghamshire County around the city centre, and asked them, do you have any patients that would be really good in research? And one doctor said, yeah, Claire would. And that's how the original 10, what I know of anyway, the original 10 patient public involvement members kind of in Nottingham were found and were picked. And so from 2005, I started working in PPI for research. Now, I did work full time at that time. I worked at Nottingham Trent University and had a career, but I did medically retire in 2011. So I did some things for the East Midlands, for Leicester and Leicestershire, and for Nottingham between 2005 and 2011. But when I retired in 2011, that's when I sort of started getting more involved. And that's when things were changing drastically, because it was when the Conservative government came in and they got rid of the PCTs. And it was a whole big change within our NHS and kind of infrastructure. So since then is when I've done most of my work. I met Adele maybe 1 or 2 years after that, 2012, 2013, when we were having the biomedical research units at that time. And Adele was working in hearing, and that was it. She was training on lay reviewing, and I helped to develop this lay reviewing for public and patient involvement members, this 3-day training course. And I helped to deliver some of it, but I also was on it. And from that, I became one of her inaugural members of the hearing, because it was hearing Adele was working in, the hearing BRU steering group. And there were 3 of us originally, myself and Veronica, who is deaf and has a hearing dog, and I have an assistance dog, so that's always been very interesting. And Fred, who is also a long-term PPI member. And we got together, and we were the first 3 members of the steering group, which grew to 7 people between then and sort of 2021. And we did so much work, it was unbelievable. So I'm going to let Adele ask me what she would like me to touch on.
Well, as I say, we did establish the PPI steering group for hearing theme. I think I established it at the time because I was feeling a little bit lonely on my own, the only PPI staff member there, and it was really to give me a steer on what I was doing with the research unit, and then it became part of the bigger biomedical research centre, and and also to give a surgery option for researchers to come along and talk about their ideas, much more of a sort of informal drop-in, really to just kickstart some PPI discussions with researchers as well. So we had very active PPI surgery, didn't we? And then also we established an internal funding scheme as well, didn't we, Claire?
Yeah,
that you oversaw.
We absolutely did. So Adele managed to get a pot of money ring fenced from the hearing part of the BRC, and she held the budget. And it was usually about once every month or every 2 months. So we would invite researchers to submit. So they'd be thinking about doing some research, and they'd have their research proposal, but what they needed pre-applying for the research monies was they needed some public and patient involvement input just to talk about. So they'll have developed a question by this point, and they'll have developed PIS, but they'll probably need quite a bit of help with this patient information sheet, and also with developing some PPI involvement in the area that they were actually going to research that was pre-grant. So we would invite them to put a proposal together, and then that proposal would come to us as a steering committee, with our hats on as a committee, and we would assess the proposal, and we would either say, yes, they're asking for, because they could ask for varying parts of money, like in the hundreds. They're asking for 400. We feel what they've said is relevant and we can offer that, or we would say, right, this proposal's not really ready. We feel they need to go away, and we'd give them pointers. Okay, you need to do this, this and this. You need to think about this in terms of your public and patient involvement. And we would help them to rewrite their script so that they could then come back to us, and we could then say, okay, that's much better. We feel that this is an appropriate use of the money for the PPI that you now want to use.
Yeah. And do you remember one of the projects that the applied money for was for looking at MRI, comfort in MRI participation? Do you remember that one, Claire? You subsequently got involved in it?
About 5 years ago, just before the pandemic. So I was kind of really excited about this one, because having a broken neck, you know, I have had many MRI scans, full spine ones, you know, many x-rays, many CT scans over the years. So I just think I'm going to sneeze. Oh, sorry about that. You don't think you're going to sneeze and then it come. If it's going to come or not. Oh, that's just got me mid-flow. So yeah, so I've had many MRIs. So I was like, oh, please let me do this, because I don't need to be have a hearing impairment to be able to do this. So we had Becky Dewey, she was kind of managing it. She came to us and she wanted money to run, I suppose, a small split focus group is what it ended up being. And myself, Andrea Junior, who was a PPI staff member, Rebecca and Adele, we put together this 4-hour meeting of people that would be willing to have MRI in hearing for research purposes, not for real, and they'd usually had experience having an MRI for research previously. So they'd got some basis for being involved in this project, and there was about 7 or 8 of them, and we had a 4-hour meeting, and we split the tables, and I facilitated one and Andrea the other. And then kind of Adele and Becky just moved between the two of us. And the question was, what is the most important thing if you are going to undergo MRI for research purposes? What is the most important thing to you? So during these 3-4 hours, both teams made lists of all these things, and then we all came together at the end, did a plenary, and pared this list right down. And Rebecca's and other researchers before this, they actually believed that what people would say is, oh, it's claustrophobic, oh, there's no room in there, oh, it's too loud. So they had all these preconceived ideas about what us as a PPI group were going to come up with. And the absolute overriding thing, what all of us agreed on as PPI members, wasn't any of the things that the researchers had thought. We wanted communication. We wanted communication from the start, right from being asked to be involved in it, to when we got to the room, to being in the room, to what was going on during the MRI for the research and for leaving. And it was overriding. So that's a really good example of how PPI actually completely changed what the researcher thought, and the whole research then went in a different direction.
And we published it, didn't we, as co-authors?
And I'll talk to you now about a really good example and a really bad example of doing PPI. So the really good example of doing PPI was in this particular project. So Adele, Becky Dewey and Andrea co-authored a paper called Talk to Us, Communication Matters, and it went into health expectations. And I was as involved as Adele or Becky. I was a proper co-author. I was fully involved in the writing, editing, analysing, appendixing, referencing this paper. That's how it should be done. That's how PPI should work. That's a good example.
Yeah.
On total other end of the spectrum, and I'm actually not going to mention actually the study's acronym this time, because I realised I've done it in another meeting, and actually I thought that was poor of me, but I didn't do it intentionally, so I'm not going to do it this time. I was involved in a gastro study in about 2012, right at the beginning. So I did all their PIS, all the upfront work they needed, and then it was a 10-year study, so they went away for 10 years, did all the analysis and the results, and the PPI really needs to take off more in that area, because in many studies it hasn't done so far, and we're very aware as a community that needs to improve. The PPI community anyway, I'm not sure the researchers are, but we're aware. Anyway, sort of in the middle of the pandemic, I get this email. Oh, Claire, you remember 10 years ago, you helped us with all this PPI in this particular study. We're going to co-author a paper now. I've got all the results in. Would you like to be part of that? Yeah, absolutely. I'd love to be. So a month passed, and I'm waiting for further information to come, and I'm waiting for, and then 6 months passed, 8 months passed, and then I'm thinking, I don't know how long this paper's taking to write. Then literally sort of 6, 8, 10 months down the line, I get this email. Congratulations. The paper you have co-authored is now live. So I had co-authored a paper. I was listed as a co-author. I'd done all the PPI at the start, but I'd had absolutely nothing to do with writing this paper or having any input whatsoever in this paper. So you can really see there the stark examples between great PPI and not so great PPI.
Yeah, and just to add to that, in terms of our co-authorship, it was very much a team effort. So, for instance, Becky Jew was the expert on the MRI and the physics of it, so she explained a lot of that in the paper, and then I explained the PPI aspects. And you did a good broad overview in terms of how the PPI should be referred to and how it should be shaped, and the overall format of the paper. So we all drew upon our own strengths, and together we made a good team, didn't we, I think, Claire?
Yeah, and I remember actually we had quite a lot of discussion about how we should refer to people, and I mean, I think sometimes in general in life we can overdo this. How do you reference people? But I think, yeah, we did have quite a big discussion about it, because we gave sort of me one term in the end and the participants another term, and we did spend quite a lot of time trying to get that right.
Yeah. So yeah. Great. And you've been involved with the bath out study as well. I mean, we only got a couple more minutes, but if you just want to give a quick overview of the bath out study, maybe, Claire.
Yeah, I'll just tell you about the bath out, because this one's been such a great study. It's so unusual. So it goes right back to 2016, and this was by Prof. Philip, I forget his last name, but Miriam Golding Day. So you probably know who I mean. And I used to sit on the adaptations committee for Nottingham City Council for people who are disabled to get grants for their houses. And Philip came and told us about this really novel idea he'd got for research. So the research that actually went ahead was about putting wet rooms in for people over 65. So you had to be over 65, you had to need a wet room, but no other adaptations doing to your house. And that was the criteria. And they had 50 people from Nottingham, and they had a control group as well. And the people that were actual participants got their wet rooms straight away as soon as the research started. The control group had to wait 3 to 6 months, which was the normal waiting time for people waiting for grants. And the idea was to compare the two groups and see what a difference it made to the lives of people, to the cost savings of care and cost savings of health, that people had got this wheeling shower instead of a bath that they couldn't use 3 to 6 months earlier. And again, the results were outstanding. And that was sort of a 1-year pilot project. And that then became a full-blown project that went on over 2 or 3 years. that's now coming to an end, and we're just writing the paper. The results are all being analysed and coming in, and we ended up using 3 sites that then went to 5 sites, so around the UK, to get more to use different postcodes in essence, because we always say it's a postcode lottery. And I can't tell you the actual results yet because I don't know them, because they're still being analysed, but I do know it's been a roaring success, and that's really classed as social care research as opposed to health research. And it was the first study that had ever been done where something physical like that in somebody's home had been done. So it was a really unique study, and I'm actually being involved in co-authoring that paper as well. And so yeah, we all need to just wait and see.
Thank you. Thank you. That's great.
Thank you.
How about you, Adele? Do you want to, before we move on to close our session, but do you want to add your own thoughts, just in terms of working with Claire, working as a PPI lead?
Yeah, it's really motivating to work with members of the public who want to help. They want to make a difference. They may have benefited from health treatment in the past, and they want to feel like they're giving back. And it's really motivating to work with people who want to contribute to research. That they're doing that. They're volunteering their time. That they're not. It's not a paid job. They're wanting to make a difference, and it's really nice to work with people like that. I think that's really motivating.
Yeah, and thank you so much, Claire.
And also, you're often surprised by some of the changes that happen as well when you have a PPI meeting. Some things you just can't envisage. It's just like, oh yeah, and as soon as it's mentioned, it's obvious, but it kind of needs somebody to say that. So yeah.
So that's going to bring us quite nicely to, I guess, our closing section, which is just kind of take-home messages.
Yeah.
So maybe just 1 point each from each of us. Adele, if you don't mind going first, and then Claire next.
Yeah, I've just got to find the slides. So,
right.
Take-home messages. Right, I'll less distracted by the slides. I think really for me it's about understanding that we spend years in training. So I've done a master's, a PhD. We spend years training basically to learn stuff and to know stuff, and you expected to know the answers to things, whereas actually I think with PPI it's about unlearning that and just taking a step back and accepting that you don't necessarily have the answers to everything, and that's fine, that's okay. And that's why you need to ask patients and the public to help you, really. So I think that's a key message from me, is to unlearn everything we've learned over our professional development, I think. Yeah.
Thank you.
Do you want me to find the slides, Ari, or shall we just do
Doesn't matter.
slides?
No, that's just it doesn't really matter. Slides is
Okay,
not
so
important. It's what Claire's going to say is more important. So Claire.
Yes.
Yeah, take away.
I would just say, listen to us, work with us, because ultimately we will benefit you and your research, and it will be better for you having engaged with public and patients.
Yeah.
Thank you. It's just like, how do you say this in one big sentence? But thank you for that.
That's what I was trying to do, Ari. I was trying not to go into a whole waffle, so I've tried to pare it down.
Yeah, that's really good. Yeah.
But exactly, and I think something from me then would be that for people, especially like clinicians or the researchers working part-time, and the most people have got a limited time and juggling things, and the people who listen to us today might think, well, I haven't got time, haven't got resources, what I'm going to do. And you don't have to start big, you can really start small. So just, engage, get to know one person well, build a relationship, take your time. But as we said, I think quality is more important. And it's about listening, observing, stopping. And sometimes you have to change your, research plan. And that's kind of, let's face it, sometimes it's painful, because we might have ideas as a university academics, and then PPI members comes in and say, hang on a minute, that might not work. And it takes time, but you don't need masses of people. You just need one or two, a good, honest, relationship to really kind of shape your research. So you can really start small. Can be time limited as well, but just it's something about the transparency and honesty. So, any more thoughts from you, Claire or Adele, before we move to question time? I think we got 10 minutes.
No, I don't.
Yep. So, yeah, and we are quite happy for the audience just to put hands up, or just we got
Has
a
there
few
been anything in
minutes.
the chat? I don't know.
Maybe somebody else.
Yeah.
Actually, somebody
Thank
asked
you,
about
or
short term.
You have got a question so far, and also a comment, somebody asking for your paper, which I've put what I think is the hyperlink in.
Let me check.
So please do check if I've, plagiarised.
Yeah,
so
that's
anyway,
it.
Lovely, thank you.
Yeah.
Thank you, Google. So there's a question from Shukrat, who is one of our PhD students. Can you please share some tips on appropriate PPIE for short-term research projects or starting late in the research cycle, so to avoid tokenism, keeping in mind the constraints of a PhD? So Shukrat is probably year 2, at least year 2 into a PhD. So a kind of a quick repair job.
I think ultimately it's never too late, is it, Claire? Obviously, it's best to involve people right from the start, but that doesn't always necessarily happen. So I think it's never too late.
We've worked with plenty, I think we've worked with quite a few people doing PhDs at varying stages. It is something that happens. PhD students come to us. I mean, there was that one a year or two ago that was to do with spinal cord injury, just by chance. And I think that was quite late. And I was a bit, I'm really not sure about all of this. But I think in the end, she did get something out of it. She got what she wanted. I think she had to change things because she left it quite late. But yeah, she did. She did do it. She did get something out of it.
Yeah, there's an example of a PhD student. We got people involved. They hadn't really been involved earlier on in the project, but she was looking to invite previous research participants who'd given their opinions on a survey that she'd done, and then she invited a number of them in to come in for a meeting to basically get their insights in terms of the overview of the data that she collected and understanding if she prioritized things correctly. And it was only then that we brought in that PPI members brought in, and they went through her presentation for the meeting and basically totally changed it. She was far too ambitious in terms of the information she was going to present at the meeting. So they really made her slash her PowerPoint slides enormously, which was a big help, because otherwise she would never have fitted it all into the meeting. It would have been totally overwhelming for the participants. And then they were there actually co-facilitating the meeting as well. And it really went very well. So even though they were only got involved later on in the PhD, it had a really beneficial effect. So it is definitely possible. I think a nice place to start is, particularly if it feels a bit overwhelming and you're in year 3, as I see a comment there, is really maybe just do a short presentation of your research and just get people's viewpoints in terms of how you presented it and how you can make it clearer. And that would be a good way in terms of them being subsequently further involved in your project. I think that might be a nice place to start it, really. And also it helps you improve your presentation skills as well. So,
Lovely,
yeah,
thank you.
Yeah.
So Wendy's got a question. So we know that Wendy's camera isn't working, so a voice will appear from a black screen.
Oh, thank you. Yeah, sorry about that, everyone. Thank you for a really informative webinar. I'm just in the process of trying to set up a PPI group. I'm a research manager at Rainbow's Children's Hospice for the East Midlands, and we're still in early stages of research. We've been research active for about 4 years now, but I suppose the things I want to know are, what would be a good size for a PPI group? Do you have a PPI group that you use certain members for certain things? Do you have like a terms of reference or anything? Just, I guess, the practical aspects at the moment. I've only managed to identify 2 people at the moment that are interested. So that's feeling, you know, like a slow process. But I'd just be really interested in your views on the more kind of practical aspects, if possible.
Yeah, interesting one. I think if you've got 2 members involved, then speak with them in terms of how they'd like it to develop, possibly. I don't think there's any right or wrong answer on this. It all depends on the area that you're working in and how much you can manage. I think in terms of meeting as a group, so for instance, I'm thinking in terms of looking at it in terms of a focus group size. A focus group, you can manage, say, 6 to 8 people. Much more than that, it can get a little bit unwieldy. So if you translate that in terms of an advisory group, that might be quite a nice number. But I don't think there's any definite right or wrong. Have you got any thoughts on this, Ori or Claire, at all?
Yeah, I think Adele's right. I'm involved in something, and because it's a really, really big kind of national project at the minute that's being hosted by UON, we've got like 25, 30, and it's growing, and it is unwieldy, as Adele says. I would say most things are 4 to 8, 6 to 8, and that is a really good number, but it is all dependent on the actual thing. And terms of reference, always we have terms of reference. Every research thing I've ever known have a set of terms of reference for PPI. I almost think it's kind of expected to have it, and it just reminds people, really, I suppose, about the courtesies of being in a meeting with people that might not have the same opinions as yourself.
And also it depends if you're dealing with a range of different conditions, then you may need, no one group may suit for all. You may need subgroups. You may yeah. So it also depends on the subject matter that you're dealing with, I think. Yeah. All right.
Agree, and
a tiny little bit.
yeah, and it's not necessarily the bigger the better or smaller the better, but just generally speaking, small groups are okay. And as we said, it's just getting to know the members, but actually developing your group with your PPI members, what's needed might be quite, kind of a good research. But for our client group, persons with dementia, sometimes people have good days, people have bad days. So we need kind of 5 or 6 people on the list so that actually allows somebody not to come in, right? If they're not having the best day. So it really depends on the nature of your client group as well. But I think just co-developing your group with the current members would be probably the best way.
Yeah, and if you're going to develop something more sort of official looking like a terms of reference, then do that with your PPI members as well. Have all these open discussions with them rather than trying to take it offline and do it separately and then voila, we've got it. So I think work with, if you've got 2 people at the moment, Wendy, I'd very much work in partnership with them in terms of how they'd like to see it develop and develop it with you. I think it'd be nice.
Perfect. Thank you very much.
Yeah. Okay.
Lovely, thank you. Any other last burning questions? Because I'm aware we've now got probably like 30 seconds left. So anybody is welcome to stick their hands up very quickly, and I shall keep a quick look. If not, I just want to say absolutely huge thank you from all of us for giving your time, for sharing your expertise. Not wishing to belittle Ori or Adele's experience and expertise, but thank you so much, Claire, because actually it's so important that we hear, from real life, and actually what it's like to be able to shape research and to feel like it's a meaningful contribution, rather than actually when it's our profession or our professional responsibilities to do it as well. So a huge thank you. Thank you for everybody